Hi everybody. The skull is described in two parts: the cranium, which contains the brain, and the face. It consists of several bones which develop separately but fuse together as the mature. The only movable bone is the mandible or lower jaw. The names and positions of individual bones of the skull can be seen here. So, they are now the functions. What are the functions? The various parts of the skull have specific and different functions. So, the protection of delicate structures, including the brain and eyes and inner ears, and the skull function is the skull maintains a potency of the nasal passages, enabling breathing, and the eating enabled by the teeth and embedded in the mandible and maxilla, and by the movement of mandible allowing chewing. This is the skull functions. So now the basic information about the skull is the skull is rests on the upper end of the vertebral column, and its bony structure is divided into two parts. One is the cranium and another one is the face. So the sinuses containing air are present in the sphenoid, ethmoid, maxillary, and frontal bones. They all communicate with the nasal cavity and are lined with the ciliated mucous membrane. So they give resonance to the voice and reduce the weight of the skull, making it easier to carry. So the cranium is formed by the number of flat and irregular bones that protect the brain. It has the base on which the brain rests and vault that surrounds and covers it. The periosteum lining the inner surface of the skull bones from the outer layer or dura mater. So in the mature skull, the joint structure between the bones are immovable. So the bones have numerous perforations, and for example foramina and fissures through which nerves, blood, and lymph vessels pass. The bones of the craniums are, you can see here in this image, one frontal bone, two partial bones, two temporal bones, one occipital bones, and one sphenoid bone, and one ethmoid bones. So now the basic information we had know that skull about, and now we are going to see the frontal bone. Okay. Frontal bone. This is the bone of the forehead. It forms part of the orbital cavities and the prominent ridges above the eyes, the supraorbital margins. Just above the supraorbital margins, within the bone, are two air-filled cavities or sinuses lined with the ciliated mucous membrane, which open into the nasal cavity. The coronal structure joins the frontal and the facial bones, and other structures are formed within the sphenoid or zygomatic or lysosomal or nasal and ethmoid bones. The frontal bone originates in two parts, joined in the midline by the frontal structure. This is the about the frontal bone. Here the facial bones. These bones from the sides and roof of the skull. They articulate with each other at the sagittal structure. So, with the frontal bone at the coronal structure, with the occipital bone at the lambdoidal structure, and with the temporal bones at the squamous structures. So, the inner surface is concave and is grooved to accommodate the brain and the blood vessels. This is about the facial bone. Temporal bones. The temporal bones lie one on each side of the head and form structure with the facial or occipital or sphenoid and zygomatic bones. The squamous part is the thin, fan-shaped area that articulates with the facial bones. The zygomatic process articulates with the zygomatic bone to form the zygomatic arc, means cheekbone. So, the temporal bone articulates with the mandible at the temporomandibular joint, the only movable joint of the skull. Immediately behind this articulating surface is the external acoustic meatus or auditory canal, which fuses inward towards the fetrous portion of the bone. So the styloid process project from the lower processes of the temporal bone and supports the height bone and the muscles associated with the tongue and the pharynx. This is about the temporal bones. Occipital bone. The occipital bone forms the back of the head and part of the base of the skull. It forms structure with the facial, temporal, and sphenoid bones. Its inner surface is deeply concave to accommodate the occipital lobes of the cerebrum and the cerebellum. So the occiput, the lower back part of the skull, has two articulate condyles that form condyloid joint. So, with the first bone of the vertebral column, the atlas, this joint permits the nodding movement of the head. Between the condyles is the foramen magnum, meaning large hole. So, through which is the spinal cord fuses into the cranial cavity. This is about the occipital bone. Sphenoid bone. The sphenoid bone occupies the middle portion of the base of the skull and articulates with the occipital or temporal or facial and frontal bones. It links the cranial and facial bones and crosses the skull. On the superior surface in the middle of the bone is the little saddle-shaped depression, the hypophyseal fossa cell thoracica, in which the pituitary gland rests. So, the body of the bone contains some fairly large air sinuses lined with the ciliated mucous membrane with the openings into the nasal cavity. So, the optic nerves pass through the optic foramina on their way to the brain. This is about the sphenoid bone. Sphenoid bone. Ethmoid bone. The ethmoid bone occupies the anterior part of the base of the skull and helps to form the orbital cavity, the nasal septum, and the lateral walls of the nasal cavity. On each side, there are two projections into the nasal cavity, the superior and the middle concave or turbinated processes. The ethmoid is the very delicate bone containing many ear sinuses lined with the ciliated epithelium and with the openings into the nasal cavity. The horizontal flattened part of the scribriform plate forms the roof of the nasal cavity and has the numerous small foramina through which nerve fibers of the olfactory nerve sense of smell so pass upwards from the nasal cavity to the brain. There is also very fine perpendicular plate of bone that forms the upper part of the nasal septum. This is about the ethmoid bone.